Well, tomorrow is World Mental Health Day, and we've got Dr. Jenna Mendelson with LeBauer Behavioral Medicine here talking about the importance of whole body wellness. Thank you so much for joining us this afternoon.
I'm happy to be here.
Well, let's start here. What impact can taking care of our mental wellness have on our physical health? First, let's start there with physical health.
Sure, it's a huge impact. There's research indicating that 14% of the global disease burden is actually attributable to neuropsychiatric conditions. So, mental health and physical health are intertwined, and taking care of our mental health is a crucial component of taking care of our physical health.
And how about our daily lives? How can mental health have an impact there?
Well, when you think about it, your mental health impacts really every aspect of your daily life, how you're feeling at at any given moment, your ability to focus and initiate and complete tasks. These are all essential to being able to function in our daily lives.
Can you give some examples too when it comes to our physical health that can be impacted by mental health?
Sure. When you think about somebody having, for example, a depressive episode, there are physical symptoms that come along with that. For example, changes in appetite, eating too much or not enough, changes in sleep, feeling tired all the time and sleeping all the time, or having difficulty sleeping. Those are very real physical impacts of an emotional situation.
Would you say we all struggle with mental health wellness at some point of our lives?
Yes. Very short answer to your question. Yes, absolutely. Just like how it would be kind of ridiculous to expect to never have a cold over the course of a lifetime. We all have ups and downs in our physical health, and we can all anticipate experiencing ups and downs in our mental health as well. They're very similar in that regard.
And I'm sure obviously life can take a toll on folks as well too, and maybe even different ages. Can you talk about
Mhm.
that too?
Absolutely. Well, we know for a fact that about 26% of American adults age 18 and older are experiencing at least one diagnosable condition in any given year. And actually, many of those people are experiencing more than one at a time. Because just like how leaving physical conditions unattended can lead to a cascade of symptoms, the exact same thing can happen with mental health. So, for example, you can have somebody who's experiencing anxiety over a prolonged period where you think about how hard that can make simple daily tasks that you have to do all the time. It's not uncommon that if left unattended, that anxiety can then lead into a depressive episode. So these things are really common, and they occur in all age ranges.
Sure. And unfortunately, some people deal with it alone and sometimes may not seek help because of the stigma surrounding mental health. So, can you kind of talk about that, the stigma surrounding mental health?
Yeah, absolutely. So that's an area where physical health and mental health, unfortunately, really do differ. So, whereas people tend to be a lot readier to seek help for physical conditions because of the stigma around mental health, some people struggle to even acknowledge that what's happening is an issue in their mental health. And if you can't acknowledge something, how are you going to deal with it? And even those people who do acknowledge that something is going on may fear that it means that they're crazy or they're broken and feel so ashamed of what they're experiencing that they don't seek help. And that's really a shame, because just like there are treatments available for a wide range of physical conditions, there are also evidence-based treatments available for a wide range of mental health conditions as well.
How can a person overcome that if they are faced with that stigma? How can they overcome that?
It's a tough thing to deal with. And I think it's just important to remember that mental health conditions happen to the vast majority of us over the course of a lifetime, for better or for worse. Roughly 10% of American adults are dealing with a depressive condition in any given year. It's just common. So, just having that in mind, that just because people aren't talking about it doesn't mean that you're the only one experiencing it. And there are a wide range of options in terms of accessing care and support.
And let's go ahead and jump into that. Can you go into detail about the resources and care that we have here locally in the Triad in Greensboro?
Absolutely. We are lucky to have some great resources right at our fingertips here in the Triad. I am a licensed psychologist with LeBauer Behavioral Medicine. We've got a great team of providers offering visits both in person and virtual. We actually partner with Cone, and Cone has their behavioral health team. They are excellent, and they are also offering visits in person and virtually. There's also the Guilford County Urgent Care Clinic if you're needing care a little more urgently, where you can have a walk-in visit if you need care right away. Because something to keep in mind is that many providers do have a waiting list of a few months. Another reason where if you're struggling, go ahead and call and get that appointment now, because there's a chance you might have to wait. And if you really can't wait, we've got a wonderful new resource, the 988 number, where if you are in a crisis, you can dial 988 and be put in touch with a licensed mental health professional immediately, anytime, 24 hours a day, 7 days a week.
If someone says it's probably just a case of the blues or maybe being nervous about something, I don't need to talk to someone, something of that magnitude, what would you say?
I would say maybe, but why suffer for longer than you really need to when there's help available? I think many people have a concept of therapy that is maybe very kind of classic and Freudian in nature, that it means that you're going to go lie on a couch and free associate for at least an hour every week for the rest of your life. But that's really not what therapy has to be. There is a wide range of treatment options available, including many shorter term treatments. You may find that you really don't need a lot of sessions to feel an improvement. In fact, there's research showing that the majority of benefit from therapy takes place within the first 6 sessions. So why not? There's very little documented harm, and there could be a lot to gain by talking to somebody.
Sure. What if you are concerned about someone, say an adult? What should you do or not do?
So this is a tough situation that can really vary based on the specifics of the situation and the individual involved. So that's my disclaimer. But broadly speaking, it's a good idea to check in with someone if you're concerned about them. And it can be as simple as asking them if they're okay. And letting them know that you're there for them. If a person really doesn't want to give you a lot of detail of what's going on, generally speaking, I recommend respecting their boundary and not overly pushing. But it can be good to go into a conversation like this prepared with some resources that you can give them. So the name of a provider or one of the agencies that we just talked about could be really good to have ready to give to somebody. And actually, if you happen to be someone who's had an experience of confronting a mental health challenge and maybe getting help for it, it could be a good idea to let the person know. I wouldn't necessarily go into a ton of detail about your experience, but just to let them know that you've dealt with something too. This can have the double benefit of normalizing for them that they're not alone, that other people go through things too. And also they have the benefit of knowing that the person or agency you're recommending is somebody you directly have good experiences with. So they might be more likely to get help that way. And if you're concerned about someone, it might be good even to offer to be there with them to make the phone call. Many neuropsychiatric conditions come with a difficulty initiating tasks as one of the symptoms. So even somebody who's really motivated to seek help might just have a hard time picking up the phone to do it. So you can offer to the person that you're willing to be there with them to make that phone call as a way to help them take that step.
Wonderful. Dr. Mendelsohn, thank you so much. And if you came in at the last second of this conversation, you can find the entire thing on our website and YouTube page, WFMY News 2.